If you're struggling with erectile dysfunction, ED, and wondering if nerve damage is the cause, you're not alone. Many men are facing this exact problem, and some of them don't even realize the potential connection between ED and nerve health. Today, we're going to dive deep into this issue, uncovering the real reasons behind nerve-related erectile dysfunction and what you can do about it. By the end of this video, you'll have a clearer understanding of what's happening with your body and how you can take action to improve your situation. So stick with me, because what I'm about to share is information that most men don't get from their doctors. You may think ED is all about blood flow or testosterone, but I'm here to tell you there's a hidden factor many men miss: nerve damage. 1. Understanding nerve-related ED. The fear of nerve damage leading to erectile dysfunction is common, but it's not as widespread as some believe. For most men, the cause of ED isn't related to nerves, but for others, nerve damage could be the hidden culprit. Understanding how nerves play a role in erections is key to understanding how ED happens. Imagine your brain as the switch that sends a signal to your penis, which acts as the light bulb. Nerves are the wiring that carries that signal. If there's damage anywhere along this pathway, the signal can be interrupted, and the result is no erection. But here's the good news: nerve damage doesn't always mean the end of the road. While complete recovery may be rare, partial recovery is much more common. So if you're experiencing ED, don't give up hope just yet. 2. The two main causes of nerve-related ED. Diabetes-induced nerve damage. Diabetes affects millions of men over the age of 55, and it's not just about high blood sugar causing your feet to feel numb or your hands to tingle. The same process can be damaging the tiny nerve fibers that control your ability to get an erection. The impact of diabetes on nerve function can be subtle, and by the time you notice the effects in the bedroom, the damage may have already occurred. What's happening? High blood sugar acts like acid on the nerve fibers, causing them to degrade over time. The earlier you manage your glucose levels, the better your chances of preserving nerve function. Regular blood sugar monitoring, maintaining a healthy diet with less sugar and more fiber, and exercising regularly are your first lines of defense. Post-prostate surgery nerve damage. Prostate cancer is a significant concern for many men, and if surgery is required, it can lead to nerve damage in the pelvic area. Even with skilled surgeons, nerves that control erections can be inadvertently affected during a radical prostatectomy. Immediately after the surgery, 50 to 80% of men experience ED. The good news is that many men begin to regain erectile function months or even years later, especially with the right rehabilitation strategies. If you've undergone prostate cancer surgery, there is hope. Early intervention with medications, pelvic exercises, and other rehabilitation methods can increase the chances of regaining erectile function. But the key is to act early. Waiting too long can make it harder to recover lost ground. 3. Other causes of nerve-related ED. While diabetes and post-surgery complications are the two most common causes of nerve-related erectile dysfunction, ED, there are several other contributing factors that men should be aware of. These conditions often go unnoticed, but can have a significant impact on sexual health. Alcohol-related neuropathy. Long-term alcohol consumption can lead to a condition known as alcohol-related neuropathy, where excessive drinking damages the peripheral nerves. These nerves are essential for the brain to communicate with the body, including those that control erections. Over time, alcohol abuse can cause nerve damage that interferes with sexual function, making it harder for men to achieve or maintain an erection. Spinal issues. Conditions like herniated discs or spinal stenosis, which involve compression of the spinal cord or nerves, can directly affect the pelvic nerves. When the nerves responsible for erections are pinched or compressed, it can result in ED. Men suffering from back pain or other spinal issues should be aware that nerve compression in the lower spine can disrupt the signals needed for sexual arousal and function. Pelvic surgeries and radiation. Surgeries involving the pelvic region, such as bladder removal or prostate cancer treatments, can lead to nerve damage. Additionally, radiation therapy used to treat cancers in the pelvic area can scar or damage the nerves over time. These medical interventions can affect the nerves that control erectile function, making it important for men to explore rehabilitation options after such procedures to restore nerve health. Neurological disorders like Parkinson's and multiple sclerosis, or MS, can have a profound impact on the nervous system. These conditions interfere with the brain's ability to send signals to the nerves that control erections, leading to ED. As these neurological disorders progress, they can disrupt nerve pathways, making it more difficult for men to experience normal sexual function. Mechanical trauma. Certain activities, such as extreme cycling or the misuse of vacuum pumps, can lead to mechanical trauma to the pelvic area. Overuse of such equipment or intense physical pressure can injure the delicate nerves in the pelvic region, contributing to ED. While these devices are generally safe, improper usage or excessive pressure can lead to nerve damage over time. These additional causes of nerve-related ED highlight the importance of understanding the broader range of factors that can affect sexual health. Recognizing these risks and seeking medical advice early can help men manage and potentially reverse some of the effects on erectile function. 4. How to treat and overcome nerve-related ED. The first step in overcoming nerve-related erectile dysfunction, or ED, is understanding the underlying cause. If you've experienced any of the conditions mentioned earlier, such as diabetes, post-surgery complications, or neurological disorders, it's important to consider how these may be affecting your sexual health. ED isn't just about aging or hormonal issues. It could be linked to nerve damage, and identifying the root cause is essential for effective treatment. Once the cause is identified, there are several treatment options available. While full recovery may not always be achievable, partial improvement is very possible with the right approach. Here are some of the most effective treatments for nerve-related ED. Medications. Medications like PDE5 inhibitors, like Viagra or Cialis, are commonly used to treat ED. These drugs work by increasing blood flow to the penis, which can help improve erectile function. While they don't directly address nerve damage, they can provide temporary relief by enhancing the physiological process required for an erection. Physical therapy. Pelvic floor exercises are a great way to strengthen the muscles that support erectile function. These exercises can help improve blood flow and nerve function. Additionally, shock wave therapy, which uses sound waves to stimulate blood flow and nerve healing, has been shown to help some men recover function after nerve damage. Mechanical aids. For some men, mechanical devices such as vacuum pumps or penile implants can bypass the damaged nerves and allow for sexual activity. These devices work by helping to achieve an erection mechanically, which is particularly useful when nerve function has been compromised. Regenerative treatments. Regenerative treatments like platelet-rich plasma therapy are gaining attention for their potential to stimulate nerve repair. PRP uses the patient's own blood to inject concentrated growth factors into the affected area, promoting tissue healing and nerve regeneration. By identifying the underlying cause of nerve-related ED and utilizing these treatment options, many men can experience significant improvement in their erectile function. While full recovery is not always guaranteed, these treatments can help improve quality of life and restore confidence in sexual health. 5. The importance of action and hope. One of the most important things to remember is that nerve-related ED is not a death sentence. While it can be difficult and frustrating, there are treatments available that can help, but you have to take action. Waiting too long to seek treatment can result in permanent damage, but by being proactive and seeking medical help, you give yourself the best chance at improvement. Partial recovery is often enough to restore a satisfying sex life, so don't lose hope. The key is to stay consistent with your treatment, work with your doctor, and explore different options to find what works best for you. If you learned something today, I encourage you to share this video with a friend who might be experiencing similar issues. Knowledge is power, and by sharing what you've learned, you could make a real difference in someone's life. Remember, you're not alone, and with the right approach, you can overcome this challenge. Subscribe to Men's Health Secrets for more insights and tips to help you live a healthier, happier life. Don't forget to share and hit that notification bell so you never miss an update. Disclaimer: this content is for educational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Always consult with a healthcare professional before making any changes to your health regimen.